Hey guys, good afternoon. Good afternoon. Do me a favor and let me know where you are watching from. Let me know what city and state you are watching from. If you happen to be watching the replay, you can also write in the comment section what city and state you're watching from. Also, as you're letting me know what city and state you're watching from, let me know where you are in your process. Like, are you a student? Did you recently pass certification? Are you getting ready for certification? Are you already working and you just need your certification? Just do me a favor, guys, and let me know who you are. Let me know where you are in your process and where you are watching from. So I'm going to get ready to get started. Let me see here. Hold on 1 second. Let me know in the comments that you can hear me too. Hi, Nicola on YouTube. Let me know, guys, in the comments. Do me a favor and let me know you can hear me. I am just pulling this up on my phone. If you happen to come across this video and you're watching the replay, feel free to fast forward to when I'm actually starting. When I'm doing these lives, I like to interact with the comment section. So with the chat. So let me know again, where you guys are watching from, where you are in your process, and feel free for those watching a replay. Oh, do me a favor, for anybody that's watching a replay, you can write replay crew in the comment section. Okay, Wayne says you can hear me. All right, so we're going to get ready to get started. Let me go over to my screen. Let me check on Instagram here, make sure I'm live here. Hey guys, watching on Instagram. So if you are watching on Instagram, this video will not stay up, but it will stay up on YouTube. All right, guys, so let's go get ready to get started. So today we're going to do phlebotomy certification prep. Now, this has been highly in demand, okay? First of all, let me tell you guys who I am. If this is your first time coming across me, my name is Kendra, aka Miss K. I've been an MA since 2004 and an MA in phlebotomy instructor since 2011, okay? I'm also an author and an entrepreneur. So outside of the medical stuff, I sell products, not even just medical products, as I'm showing you guys here. I do have a lot of medical assistant t-shirts and pillows and mugs, and then my stethoscope necklaces that's fully customizable with your name. That link will be in the description of the video, but the site is Shop with Ms. K. So it's instead of Shop with Ms. K with two S's, it's two Z's. So you can check me out there. But those are some things that I do outside of the medical assisting world. This video was in high demand. Let me go to the next slide first off before I talk about it so I can let you guys take a screenshot of this. So go ahead and take a screenshot of this while I talk really quickly before we get started. So a lot of you guys have been asking me to do phlebotomy certification videos. Now, I will tell you guys this. As medical assistants, if you're watching this video and you're a medical assistants, we do phlebotomy within the program as well. Okay, so a lot of people that follow my channel are only doing phlebotomy, and they've been asking me, "Hey, Miss K, can you please do some phlebotomy only videos?" So I said, let me do some certification. Now, this exam practice is going to be for anybody that is studying for phlebotomy certification, such as the CPT through NHA or the NPS, National Performance Specialist, and any other phlebotomy certification. As I always mention to you guys, they all ask the same type of question. So just a few tips before we get started. I want you guys to take a screenshot of it if you haven't already. But with any certifications, you want your life to revolve around your study material. So you should have a set schedule. Mondays, Wednesdays, Fridays, however you want to do it, Tuesdays and Thursdays, but you need to have a schedule for your study time, okay? As you're going through the practice test, first of all, you should have the practice test that is included within your study materials. As you're going through your practice test, you want to pay attention to wrong answers, because those wrong answers are most likely going to be on the exam as well. Okay. Do not focus more on the practice test questions than you do on the content. As you guys are going through your practice test questions, I get a lot of comments under my video sometimes, and saying that question wasn't on my test. Don't focus on the question, focus on the content. So that way you know the information. This is why in my study videos, this is why I do open-ended questions as well as multiple choice. I do open-ended questions because if you can answer open-ended questions, you know the material. This is how you focus on the content, by being able to answer open-ended questions. Okay. Another thing I want you guys to do is do a Google search for the test plan and use it as a checklist. All you have to do is go to Google and just type in test plan for the CPT or test plan for the NPS. Whatever test you're taking, just Google it. It's going to probably take you to the website for the test, but it's free. Wherever it takes you, it is free. Download it, use it as a checklist. Everything you know on it, everything on it that you already know, you're going to highlight it, check it off. Everything you don't know, you're going to go back to your study materials and find the answer. The test plan tells you everything you need to know for the test. Create flashcards and have a family member quiz you. Now, as you're going through the actual test, these next 3 questions are relating to when you're actually taking, these next 3 tips are relating to when you're actually taking the test. When you're taking your test, make sure you're paying attention to keywords, to each question. Sometimes people, they answer before they even read the entire question. So make sure you are paying attention to the actual questions and recognize keywords. Like if they're saying first, what do you do first? Or what do you do initially, right? Hey, Tanya. Use process of elimination. As you're going through the questions, use process of elimination. So eliminate answers that you know are absolutely incorrect. And then also when you're going through, you want to answer your easy questions first. Difficult questions, save them for later. Flag those questions, or you may see the option to bookmark or flag them and come back later. Somebody says, I'm taking my phlebotomy class this semester. I start hand drawers next week. Any tips? So I actually have a lot of tips on phlebotomy. I'm just going to answer your other question in order, drawer, because I don't want it to get too long because I have so many tips on phlebotomy. One thing I will say is practice, and watch phlebotomy videos. I have a few on my channel. As far as your order draw mnemonic, one of the ones that my students use is young boys really get great looking girls. I'll just repeat it one more time if somebody wants to put it in the chat. So you definitely got to know the order draw. That is a tip that I will give you guys when it comes to an additional tip. Know that order draw and the additives. So I say it again, young boys really get great looking girls. Anybody can feel free to put that in the chat for us. Young boys really get great looking girls. That's a mnemonic that me and my students came up with, and we use that to remember the order of draw. All right, so we're going to get ready to get into it. I use the mixture of open-ended questions and multiple choice for this practice session. Okay. Thank you, LB, for putting it in the chat. Now, the reason why I do both open-ended and multiple choice, first of all, it takes forever for me to create multiple choice slides. I'll be honest with you guys, but I did do some because I want you to, the multiple choice questions that I did create, I did that for a reason, because I do want you to see the wrong answers. I want you to see some of the options they're going to give you on the test. And I did open-ended because I want you to be able to answer these questions in an open-ended way. And plus, it's easier for me to create these slides. If you guys want me to keep doing these, I need to be able to do open-ended because it's easier to create. All right, so let's get into it. The destruction of red blood cells. What is that? Destruction of red blood cells. Destruction of red blood cells. So if this is anybody's first time visiting, the way I do these, I give you guys a few minutes to answer in the chat. Well, not a few minutes, but a few seconds. I put the question up and then I give you guys a couple of seconds to put it in the chat. This is why if you're watching a replay, you may want to watch it on fast mode or fast forward to okay, so you guys putting the answers in. Yep, hemolysis. Yep, hemolysis. That's absolutely correct. All right. When collecting a sputum specimen, which of the following instructions should be given to the patient? Rinse your mouth with mouthwash before we collect the specimen. Breathe deeply and then cough up a specimen into the container. Gargle some water before we collect the specimen, or leave your dentures in during specimen collection. Which one of these instructions is correct, guys? Which one? A, B, C, or D? Which one is correct when it comes to collecting sputum specimens? Now, as phlebotomists, you guys know you're going to be collecting blood. urine, sputum, even sometimes semen specimens as well. All right, I see your answers rolling in. Okay, if you chose B, you are correct. Have them to breathe deeply and then cough up a specimen into the container. The other instructions given are incorrect. These are not instructions that you would give them before taking a sputum specimen. What is the correct ratio of sodium hypochlorite or chlorine bleach to water when disinfecting items that have been contaminated by blood? What's the ratio? What is the correct ratio? One thing I want to mention too, so this certification practice is for anybody that's taking phlebotomy certification, and it also helps for the phlebotomy type of questions that's going to be on any of the medical assistant certifications as well. Okay, so it's 110. It's going to be 1 part bleach, 10 parts water. Okay, so it's 1 to 10. That's the ratio. All right, 1 to 10. A patient rolling up her sleeve is an example of what type of consent. So the patient is sitting there, they roll up their sleeve, they give you their arm. What type of consent is that? They're giving you their arm to draw their blood. What type of consent is that? Are any of my Facebook people here? I'm live on Facebook too. I'm not seeing any comments on my from Facebook. Anybody in my Facebook group here or page here, feel free to comment on the post. I see my Instagram people chiming in as well. Okay, so this is going to be implied consent. I see somebody put nonverbal, and I see somebody on Instagram put informed. So implied consent is correct. So implied consent means based on a person's actions, they're giving you permission. So she handed you her arm or she rolled up her sleeve. That is implied consent. Now, informed consent is when the patient is actually signing that they've been, they've gone over the risk and benefits of a certain procedure. They know that there are alternatives. They know that they can turn it down. That is what informed consent is. Okay. All right, which tube should be selected when drawing a CBC? Now, this is another important thing. Make sure you guys taking this phlebotomy certification and even a medical assistant when it comes to the phlebotomy part of the medical assistant certifications, make sure you know some common tests that you will be drawing in each of the tubes. Okay, so you got to know the order of draw, the additive that is in those tubes, and then what laboratory department is going to, as well as some common tests. Okay. So EDTA. So the way that they will have the tubes written, they may have the color there, which we know is lavender, right? EDTA is lavender, or they may name the tube by the additive that's in it. So be prepared for that. So it may not say lavender as an option. It may just have the additive. It's okay. It's all right. You don't have to be sorry for putting, because it's still a form of nonverbal consent. It's just that it's the correct, the actual the correct term will be implied consent. The type of consent will be implied consent. Okay. So, and it's okay. And I want you guys to know, let me go to the next one, let you answer that one while I make my next point. Which tube should be selected when drawn for a chemistry test? But I was going to say, I want you guys also to know that when we're going through this, if you happen to get the answer wrong as you're putting the answers in the chat, it is perfectly okay. This is why we do these. I tell my students the same thing in class. If you answer incorrectly, it's okay. Give yourself some grace. This is why we do these study sessions, so that you can get the right answer. So it's okay. And I give you time. I wait a few seconds between, each one, because I want to give you time to answer. And if you get it incorrect, that's fine. Just make sure you write down the correct answer as we're going through this. And this is good because then you know what you don't know, what you need to study more of. Okay, so chemistry test is going to be the serum separation tube, or SST. Okay, so now SST, we know can be gold or marbled, right? We know SST is gold or marbled. And so, and that mnemonic, I'm speaking to LB right now. LB, you asked me the mnemonic for the order of draw. that's where your get comes from. We say young boys really get great looking girls. That get is for the G, for gold. And that gold is going to be gold/marbles, because that's the SST. Okay, so it can be gold or marble. Which tube should be selected when drawn for coagulation studies? Which tube? Yep, red and gray is SST or gold. Yep, that's correct. Which tube is going to be selected when drawn for coagulation studies? Coagulation studies. Just chiming in from Texas. Hi, Tevra. Let me know what part of Texas you are watching from, because I'm thinking about relocating to Texas. I promise you, Tevra, it is on my list. Let me know what city you're watching from, Tevra, and how you like it, because I am strongly considering relocating down there. Okay, I do see my Facebook people. Yep, that's her. Miss Cat wanted to say thank you. I stayed up all night. Oh, congratulations. Okay, coagulation studies. Sodium citrate, which is what? Light blue. Correct. Not just blue, but light blue. You guys are correct. Light blue. So again, they may list it by the additive, or they may just have the color of the tube. So just be prepared for that. All right. Which site should a phlebotomist choose for an older patient with difficult veins? So you have an older patient to come in to get her blood drawn, but she's older and she has difficult veins. So where are you going to go? Where are you going to go to draw her? Oh, 200 miles from Houston. Okay, I've never heard. Is that a rural area, Tevra? I've never heard of Lufkin. Let's see my Instagram people. Oh, congratulations, Tracy, for passing. Tracy on Instagram says she passed her CCMA. Congratulations. Okay, let's see. So for difficult veins, older patient, you're going to go to the dorsal veins, right? That's the hand, the back of the hand. All right. And of course, you're going to use a butterfly. So, and that's another thing too to note. It may say butterfly or it may say winged infusion set. Okay. And do me a favor, guys, if you're enjoying this video on Facebook, either way, Facebook, Instagram, or whatever, make sure you like it, specifically YouTube. If you're watching on YouTube, I'm not just reacting in the chat, but actually exiting out the chat to actually like the video. It helps with the algorithm and getting it out there to more people. All righty. At what temperature should semen samples be stored and transported? This is another thing that's going to be important to know. Make sure you know your temperatures for your different specimens, okay? Because certain specimens, there are different temperature ranges for different specimens. So be familiar with that. This is not really if you're taking a medical assistant certification, this is most likely not something you will see before phlebotomy certification, definitely. Okay, let's see. Okay, so it should be 37 degrees, 98.6 degrees Fahrenheit, 37 degrees Celsius. Okay, so normal body temperature. All right, so make sure you know those ranges. And the reason why, again, some of these are open-ended questions because you know the temperature. So it doesn't matter when you go take your test and they have a multiple choice question and they throw out, 80 degrees, or they throw out 75 or 100 degrees or whatever, you know what the answer is. So it doesn't matter. This is one of the reasons why I say know the content and don't focus on the questions, because when you know it, you know it. All right, so what do you do if the patient tells you that he or she is allergic to latex? What do you do? What do you do? Person says, oh, I'm allergic to latex. I can't use latex. What do you want to do? What do you do? What do you do? I'll give you guys a couple more seconds. I know you got to kind of write it. That's an open-ended question, an open-ended answer. Okay, so I see the answers coming in. Yep, you want to use non-latex gloves, also non-latex bandages and tourniquets as well. So every lab should have this available anyway. So I don't work in a lab anymore, but everything was non-latex just to be on the safe side. So we use nitrile gloves. So nitrile gloves may be an option that you'll probably see on the test, non-latex. So most places now they just go on the safe side, and everything is just non-latex, just to make sure. But you want to use nitrile gloves, and everything should be non-latex, even the tourniquets. What is the purpose of inverting anticoagulation tubes? So what is the purpose of inverting anticoagulant tubes? What's the purpose of inverting? You guys know as you are drawing your patient. Okay, Tevra says driving. So listen. Okay, you don't text and drive, Tevra. I'm glad you're listening and don't text and drive. And thank you for being a top fan. I see you have a top fan crown. Okay. So what's the purpose? To prevent hemolysis. Also to one of the purposes also for inverting is also to get the additive mixed in. So when you guys, after you finish drawing your blood, you want to invert your tubes. Each tube has a certain amount of times that it's supposed to be that is one. That's it. Yes, LB. That's also. Oh, you retracted it, LB. Yes, that's also one of the options. You retracted your answer, LB. But yeah, you were correct. That's one of the reasons too for inverting. So yeah, so to prevent hemolysis, and also you want to mix your additives in your tube as well. Now, how many times should an EDTA tube be inverted? You got to know how many times each tube should be inverted. And I'll give you guys a hint. I'll give you guys a quick way to know the difference as well after we answer this question. Well, I can say it now while you guys are writing it. So one trick to remember how many times, when you think about the order of draw, the first tubes that you're drawing, those have to be inverted. Actually, I may be about to tell you guys incorrectly. Hold on, let me think about that. Let me think about what I'm saying here. Hold on. Nah, that's not a good hint. That's not a good hint. Disregard that. Sorry, disregard. I was about to tell you guys that's actually not a good hint. Never mind. But I'll figure one. I'll have one for you guys next time. But definitely know how many times each tube needs to be inverted. Okay. Yep. LB 8 to 10. Yeah. LB said 8. Yes, 8 to 10. Tracy, yep, you're correct. Eight times 8. You guys both put 8. Yes, it's 8 to 10 times. And I guess I can say that. So if you guys notice, like when you're looking at your order drawer, like if you notice like your tube, like your first few tubes, they have to be inverted less. So when you think about which ones have to be inverted 8 to 10 times, think about the tubes that are at the end of the order. And those have to be inverted more times than the rest, right? So as you go down the order, you have to invert more and more. All right, which of the following should be worn while drawing a patient with tuberculosis? Sterile gloves, surgical mask, gown, or N95 respirator. So you're drawing a patient who has tuberculosis. Which of the following has to be worn? Okay. All righty. If you chose D, you are incorrect. The N95 respirator. The others are not enough to protect you from tuberculosis. When should a chain of custody form be used? And you guys can just give me one option in the chat if you want, just one reason, like and give me at least one situation in which a chain of custody form will be used. The chain of custody. When should a chain of custody form be used? Hey, Kiara on Facebook. I hope I'm saying your name correctly. Or Keita. Maybe it's Keita. Keita. Sorry. Okay, so chain of custody is used for drug screenings, forensic studies, blood alcohol tests, and maternity testing. Okay. Yeah, so DNA paternity testing. Yep, LB, yes. So any of those reasons. So if you see any of those reasons as an option on your test, so the way they throw it out there, they may say, you know, which of the following is a chain of custody form needed. They may throw drug screening in there. Then they'll have some other random tests. They may say a CBC or just some random a pregnancy test, just some random other tests they'll have on there. Urine culture, random tests. But you guys know these are the tests for which a chain of custody form is needed. Okay. Which of the following is appropriate when collecting urine for drug testing? You want to verify that the specimen contains at least 45 milliliters of urine, or do you want to ensure the specimen is within 69.9 degrees to 79.8 degrees Fahrenheit? Are you going to take the temperature of the specimen within 6 minutes of collection? Or you going to tell the patient to flush the toilet twice? Which of the following instructions which of the following is appropriate when it comes to drug testing? A, B, C, or D? Yay, Zaria, I'm glad you made it. Zaria says I made it live and not the replay. I'm glad you made it. So we're doing phlebotomy certification prep today, Zaria, and anybody else that's just joining. This is going to help with the CPT or NPS certification. It also helps with the phlebotomy section of the medical assistant certification. Okay, so A, B, C, or D, which of the following is correct? Now, this is a popular question that I often see posted in my group on Facebook. I've seen so many people post this question, wanting to know the answer. This is a hot topic question right here. Let's see if anybody on Instagram. Okay, y'all ready? I don't see no answers popping up for this one. Just take a guess. All right, so if you chose A, you are correct. The other ones do not apply because, first of all, we don't want to tell the patient to flush. The patient is not supposed to flush anyway. So you can rule that one out. As far as C, it should be, the temperature should be taken within 4 minutes, okay? Within 4 minutes. So that's 6, you can automatically rule that out. And then B is too cold, 69 to 79 degrees. The temperature should be body temperature. It should be like the body temperature is 98.6 degrees. It should be within that range. Okay, so everything else you can rule out. And this is one of the things when I mentioned focus on the question and focus on the content and not the question, because they may ask you in a different way. Okay, they may ask you in a different way. The next question, it may be about, instead of asking, which of the following is appropriate, they may ask you about, they may say how many, milliliters of urine is appropriate for drug testing. Or they may say, I mentioned that the temperature needs to be taken within 4 minutes. Another question may be asked, how many minutes within collection should the temperature be taken? Now it's 4 minutes, okay? 45, yep, is the, yes, yep. Yep. You got it. Okay, guys, I just want to remind you all about my MA refresher course. This is just a quick interlude. So in the MA refresher course, this is for anybody that's preparing for MA certification. I know most people that's going to watch this video is probably taking phlebotomy, but some people started phlebotomy going to MA. So I do have the MA refresher course. It's filled with lessons, just like I'm teaching you guys now. Quizzes, you get a score. There's video lessons to watch. You take a quiz, and then you take practice tests as well. And you get a certification at the end that you have taken and successfully completed the MA Refresher course. So it's marefreshercourse.com. And the link is also, as a matter of fact, let me put the link in the chat right now really quickly while we on our quick commercial break. Let me see, where's the link? So for anybody that's interested in it, I'm putting it in the chat right now. Let me just copy it really quickly and put it in the chat, and then we'll go to the next slide. Oh, let me put it on Instagram as well for my Instagram people. All right. Next question. What is the expected reference range for a fasting blood glucose? Another example on focusing on the content. So if you know the ranges, right? And this is another example of why I ask open-ended questions, because if you know the range, when they give you a question on a test, they'll say something like, which of the following, fasting glucose readings is normal? Or it'll say something like, which of the following would indicate a need to notify the provider of an abnormal result? And you have to recognize which of the listed options is abnormal, is too high or too low. Okay. What's the range? Okay, so if you put, I went too fast. Sorry, guys. So if you put 70 to 110, you're correct. Now it has changed. The ranges have changed. It was 80 before. It was 80 to 100 before, but now it is 70 to 110. Okay, so if they give you a question and it says, which of the following should you recognize as abnormal, and it's anything below 70 or above 110, then you know that is abnormal. Anything in between that will be normal. Which of the following cleansers should be given to a patient for a clean catch urine specimen? Alcohol, hydrogen peroxide, povidone iodine, or mild antiseptic soap? I'll wait for you guys to answer. A, B, C, or D. Yes, LB, 45 milliliters is equal to 1.5 ounces. Okay, let's see. Yep, so if you chose D, you are correct. So you guys know what alcohol and hydrogen peroxide is. Povidone iodine, that is an example of a cleaner that when you are another name is betadine. So it's a sterile solution. So it's what you would use if you had to do a sterile procedure. So if you're cleaning a patient that needed like a maybe they were getting like some stitches put in, or maybe like for a procedure. So you have to clean their skin, or even when you're doing your surgical scrub and you're scrubbing with betadine. So it's a sterile cleanser. It's a sterile solution when you need to be sterilized. Which of the following pieces of PPE should be removed first when exiting an isolation room? So you're dealing with the patient in an isolation room and you're about to exit the room. Which do you remove first? Now, this is an example of recognizing keywords, which is remove first. Now, we know all of it is going to come off, but what's going to come off first? A, B, C, or D? Which is going to come off first? Okay, I see the answers coming in. Correct. Your gloves. Yep, correct. All right. What should the phlebotomist do if he or she notice a hematoma forming at the puncture site while drawing blood from a patient? So you're drawing your patient's blood and you notice a hematoma is forming. What are you going to do instantly? What are you going to do first? What are you going to do first? Yep, you're going to remove the tourniquet and needle. Yep, you're going to stop instantly. If you notice a hematoma, don't collect. Now that you're going to see some options that's going to say continue collecting, wave the site. You're going to see some random things, but you just want to know that it's removing the tourniquet and needle. That's the first thing you want to do. Which technique should be used when applying an antiseptic to the puncture site? So you're about to draw your patient's blood. You got to cleanse the site. Which technique are you going to use? How are you going to clean it? Now, it used to be circular motions from the inside out. And they technically changed that standard now. I happen to still believe in the circular motion inside and out, but they have changed the guidelines. Okay, so I want you guys to know that it's going to be back and forth strokes. So you'll see some random options there, but it's going to be back and forth strokes. Okay, you'll see an option for one time, just wiping it one time. You may even see circular motion as an option. That's not going to be the option anymore. It's going to be back and forth strokes. Which of the following is in the correct order? Identify the patient, cleanse the site and assess the site, insert the needle, place the tourniquet and label the tube, assess the site, cleanse the site and insert the needle, or draw the specimen, remove the needle and remove the tourniquet. Now, Zaria, is this my old student, Zaria? Is that you, Zaria? I had a Zaria with that name. I just thought about it as I'm seeing your name pop up. Is that you, Zaria? Which one is correct? Oh, she said no. Okay. I had a student with your same name. And we're actually co-workers now because she worked for the same company. We were on a meeting. What's so funny, Zaria, is we were on a meeting and I noticed her name in the chat. And I was like, Zaria, is that you? And it was her. So we work for the same company now. Okay, so let's see what you guys. Now, a lot of you put A, I think because you noticed the identify the patient part. But remember, pay attention, read closely. It says identify the patient, cleanse the site, and assess the site. We will have to assess the site first, then cleanse it. Okay, so we have to rule that one out. Even though it says identify the patient, be careful when you're reading those options because it says cleanse the site and then assess. You don't cleanse the site until you're about to stick. By the time you're about to stick, you've already assessed the site to see where you're going. B, we ruled out because it says insert the needle, place the tourniquet. That's completely out of order. D, of course, because it says draw the specimen, remove the tourniquet. But C is in the correct order. C, before you cleanse the site, you're going to assess it. And of course, before you insert the needle, you're going to cleanse the site. And it's okay. I know a lot of people saw that identify the patient and immediately chose it. But this is just an example of just making sure you read it carefully. Which form of patient identification should be used in inpatient settings? So which form, how are you going to identify your patient if you're in an inpatient setting? How do you identify your patient? You're welcome, Jacqueline. Congratulations. How are you going to identify your patients? When it's inpatient, you verify verbal as well as looking at their wristband. So you have them state their name and date of birth, as always, just like in outpatient settings, we have them state their name and date of birth. You never say it for them, right? But then you also want to check their wristband. You want to make sure their wristband matches whatever orders you have in your hand. It matches what they say, right? It matches their chart. Glad you made it safely. What should be done for a patient who usually faints during a blood draw? So you're about to draw your patient and they tells you that whenever they get their blood drawn, they faint. What do you want to do? Glad you made it safely, Tevra. What do you want to do? They say I always faint when I get my blood drawn. What do you want to do? You want to draw the patient's blood lying down. You want to have them lie down and draw their blood. Now, a lot of phlebotomy seats now recline, so that way the patient can lay down while you draw their blood. And then after you draw them, you want to let them continue to lay down for 15 minutes before you let them go. What information should go on the collection tube and when should it be labeled? So I put this question as a two-parter because you can be asked either of these questions. You're going to be asked questions about what's supposed to go on a collection tube and also when it should be labeled. Okay. So first of all, the label should be always labeled in front of the patient. So if you see that as an option, in front of the patient, not before you draw. They're going to trick you and they're going to have that as an option before you draw the patient's blood. That's never an option. It's going to be in front of the patient before you draw their blood. Okay. Now the information that goes on the tube is the patient's name. Is going to be their date of birth, the date, the time, and the technician's initials. Okay, so those are the 5 things that go on your tube. You're going to have the patient's name, their date of birth, the date, the time, and your initials. And you're going to label it in front of the patient after you draw the blood. Okay, as long as you know that, it doesn't matter how they ask it because you know the correct, you know the correct way of doing it. Okay. What is the normal range or what is the reference range for total cholesterol? You guys are going to have to know the ranges for common tests as well. You got to know those ranges for common tests as well. So like cholesterol, hematocrit, hemoglobin, potassium, sodium, what else? We mentioned glucose already. CBC, maybe you probably gonna have to know. Yeah, because you got to know for red blood cells, white blood cells, and platelets what's the correct number. You got to know that. What else? Pretty sure something else I'm missing, but make sure you guys, I believe TSH as well. Make sure you guys know those normal ranges. Okay, so for total cholesterol, it's going to be 140 to 200. Oh, in addition to total cholesterol, you're going to have to know your LDL, which is your bad cholesterol, your HDL, as well as your triglycerides. So your total includes all of those, and you have to know each of those individually, your LDL, HDL, and triglycerides. Make sure you write those down and go get those numbers from your study material. Which of the following specimens should be placed in an ice bath within minutes of collection? A blood culture, a urine culture, a 24-hour urine, or ABG, which is the arterial blood gas. They may not write out arterial blood gas. It may just say ABG. Which of the following is it? A, B, C, or D? Has to immediately go in an ice bath. Immediately go in an ice bath. Okay, let's see. If you said D, you are correct. An ABG immediately goes in an ice bath within minutes of collection. Which of the following is the correct action after removing the needle from the patient's arm? Are you going to invert all the tubes? Are you going to remove the tourniquet? You're going to engage the needle safety device or ask the patient to open his fists? After removing the needle, are you going to invert all the tubes? remove the tourniquet, engage the needle safety device, or ask the patient to open his fist. All righty. Yep, you guys are correct. And remove the tourniquet. We already know we did that after a minute, or after depending on how long it takes you to be out there, a minute, or once you get to the last two, depending on which one comes first. And then we ask the patient to open his or her fist once the blood starts drawing. Now, inverting the tubes, this is a good example of seeing two options that, oh, we do both of those after removing the needle. We do have to invert the tubes. What do we do first? We have to engage the needle safety device. Okay, we definitely have to engage the needle safety device. Which of the following pieces of PPE should be worn when drawing blood from a pneumonia patient? A gown, N95 respirator, a mask, or goggles? So pneumonia patient, gown, N95 respirator, mask, or goggles? Okay, so in this case, it's going to be a mask. So pneumonia, you have to be exposed to droplets, whereas the option earlier was tuberculosis, which is more contagious. It can be in the air. Okay. So this is going to be, yep, LB correct. So yeah, this is going to be a mask. Okay, so a mask is enough for pneumonia because you will have to be exposed to the droplets of the patient. Okay, whereas the tuberculosis is more contagious. That's why you needed the N95 with the tuberculosis versus a mask with pneumonia. What should be done first if a phlebotomy technician witnesses another tech receiving an electric shock from an instrument? What should be the first thing that the phlebotomy technician do? You were in the lab with the patient and you notice that the tech is using an instrument and they get an electric shock. The first thing you want to do is eliminate the source of the shock. So you're going to shut off the power to the instrument. Okay. Good luck with that, Zaria. Yep, Honeybee says unplug. Yep, shut off the power to the instrument. We getting to the end, y'all. We only got, I think I got a couple more slides left. But which of the following additives is used to prevent the breakdown of glucose? Oh yeah, we literally only have, oh, I think this is the, I'm sorry, I think this is the last one. Tevra is giving you congratulations in advance, Zaria. Which of the following additives is used to prevent the breakdown of glucose? It is sodium fluoride. And how do we know that? Because that is the tube that we draw for the glucose. Now, EDTA is lavender, heparin is green, sodium fluoride, that's going to be gray, and sodium citrate is what? Light blue. Okay, guys, so this is it for now. Do me a favor, my YouTube people, exit out of the chat and like the video for me if this was helpful to you. My YouTube people, if you're not already subscribed, make sure you do so. If you're watching on Instagram or Facebook, you can head over to YouTube and subscribe and like the video. Facebook now only keeps live videos for 30 days and then they delete them. Instagram is going to delete instantly. So if you want to be able to watch this video again or send it to somebody you know that may need it, you have to go over to YouTube. Let me know if you guys have any questions in the chat. I got a couple of minutes. I can wait just to see if you guys have anything before I let you go. My Instagram people, thank y'all for joining in. I'm going to go ahead and, Instagram, I'll wait a couple minutes, see if you have a question too. But let me know. Good luck to everybody that's about to take your test. Congratulations to everybody that have recently passed. I'm going to do more of these videos. As I mentioned, these phlebotomy certification videos have been in high demand. So I'm going to create a YouTube I'm going to create a playlist just for phlebotomy certification. Do me a favor, guys. Let me know really quick in the chat, who is a phlebotomist here? Who is getting ready for phlebotomy certification? Sorry, I know you said, oh, you said you're taking CCMA. Who's preparing to take phlebotomy certification? Who is preparing to take phlebotomy certification? Let me know. Hopefully this was helpful for you. This was also for the, you're welcome, Tracy. I'm gonna go ahead and end this now. You can meet me on YouTube. As I mentioned, this video is also for phlebotomy certifications, but it's also for anybody that is preparing for MA certification as well. Phlebotomist 3 years. Okay. Thank you, LB. I'm glad you like them. Oh, Julian, my Instagram is same as my YouTube, Medical Assistant with Miss K. It's at Medical Assistant with Miss K. It's the same, at Medical Assistant with Miss K. Okay, guys, I don't see any comments, any questions in the comments. So I'm going to go ahead and let you guys go. Thank you so much for hanging with me on a Saturday afternoon. Good luck, everybody. Congratulations to everybody that recently passed. MArefreshercourse.com for anybody that's preparing for MA certification and need an online study guide. Let's see, my Facebook people. I'm sorry, I forgot all about my Facebook people. Let me make sure nobody on Facebook is saying anything. Hey, Kiana. All righty. Nobody else on Facebook. I landed a job that was supposed to train for MA but toxic. Oh, wow. Okay. Sorry to hear that, Several. All right, guys. Y'all have a good afternoon. I will see you guys next time. Take care.